appreciate it. Thank you for holding this very important hearing, and thanks for being so persistent, along with Representative Castor, on advancing this very important bill. In the Tampa area, we have St. Joseph's Children's Hospital.
We have late-breaking news. Dr. Murphy's just co-sponsored the bill.
Awesome.
Let's give him a round
All
of
right,
applause.
good job. I didn't have anything to do with that, but in the Tampa area, we have St. Joseph's Children's Hospital, which has been successfully running the chronic complex clinic for children. I had the opportunity to visit the clinic at least once. And it's one example of how to successfully treat children with complex medical conditions. I'm pleased that Ms. West is here as well. And her daughter, of course, is a patient at St. Joe's. Ms. West, can you talk about how successful or unsuccessful the treatments before you came to St. Joe's were, and what it's like now for your daughter to be a patient at St. Joe's?
Well, she's 19 years of age, so we do have a diagnosis, and we pretty much are in a routine of managing her care at this point. But early in her life, we didn't have a diagnosis, and so the diagnostic process was pretty crazy, trying to go across state lines and visit doctors who had various expertise. And I always wondered, like, who's helping me here? Who's the case manager? And it found out that I was the case manager. And that was shocking to me because I didn't have the expertise, but so I had to quickly get the expertise. When going to the chronic complex clinic, there were social workers there, case managers, people who were educated to help me navigate the healthcare system, the Medicaid system. And that was huge, not only just for me, but now also for Caroline's overall health. We were seeing doctors in a more timely fashion. When we needed to see a gastroenterologist, sometimes we could get the appointment the next day through the clinic instead of having to go home, get on the phone, make an appointment, wait a month. Those kind of issues are really, really important, and all of that works seamlessly through the complex clinic.
What was her medical condition at the time?
She has a rare disease called alternating hemiplasia of childhood. You don't need to remember that. It's complicated, but she presented with seizures, low tone, cerebral palsy, posturing, nystagmus, eyes bouncing all over the place. And it was a mystery because at first they thought she might have seizures, and so we hooked her up to EEG, and she wasn't having seizures. So, then after that test was over, we would be dismissed. So then we had to continue to pursue. There was something wrong with her. It's not seizures, it's something else. So eventually we did get a diagnosis of alternating hemiplasia, which is a rare neurological disorder by a genetic mutation, spontaneous genetic mutation.
Okay, as a mother of a child with a complex medical condition, how important is it for good care coordination for both the patient and the caregiver?
Well, I mentioned early on in my testimony that at one point before we went to the chronic complex clinic that we actually had to check into the hospital to get all of our doctors to communicate with each other. And that was pretty costly to the system, I think, plus also to our family, where that doesn't happen now.
Okay, question for the panel. Is there a standardized definition of a medically complex patient? Who would like to go first?
I think across the country, we've pulled together a lot of stakeholders to try to pull that together. And I think most agree on that the core attributes are a lifelong chronic condition that affects multiple organ systems of the body, that leads to significant impairment. And even just that in itself really helps articulate and carve out the kids that we really think are complex.
Anyone else?
I just would like to urge everyone to please work on a definition that is clear, because I would hate to see this get diluted. I think it's important to keep it focused on kids who do have complex illnesses. As I mentioned earlier, going to a typical pediatrician's office was not a really healthy experience for any of my family or for my daughter. But so going to a clinic where there are lots of kids who have medical complexity is much better. That the doctors are more educated. We get things done faster and more efficiently, and our daughter's more healthy.
Anyone else want to elaborate on that? Okay. Next question. I know I only have a few seconds, Mr. Chairman. Care coordination is obviously so important, especially for parents with severe conditions. How do we promote greater care coordination in fee-for-service framework? Who would like to take that first?
I would say that the intent is to move actually away from fee-for-service, and if you look at the intent of ACE Kids, it's actually to move to an at-risk model. And so if we're able to ramp up through shared data, a common definition, quality standards, and reporting at the national level, that will allow us to accelerate our ability to better coordinate care, reduce waste, the fragmentation of care, the episodic care that occurs with this patient population today, and ultimately move to the budget certainty that this bill or this act contemplates.
Anyone else want to chime in?
Okay, the gentleman's time's
Okay.
expired. We'll let
Thank you.
Dr. Berry look like he was just bound to say something, so we'll give him.
Well, I will say here's just one anecdotal example, but the Michigan Medicaid program has instituted a policy for reimbursing clinicians in their fee-for-service model for non-face-to-face healthcare encounters for children with medical complexity. Phone calls, paperwork, developing care plans, multidisciplinary team meetings, and just doing that, I think, is incentivized the providers to take on those clinical activities and do them well. It's a Band-Aid, but it's working.
Thank you so much. Appreciate it.
Thank the gentleman. And now